Divorce is hell, but sometimes it is what we needed to grow. On today's program, we bring you the experience of divorce told in humor rather than just in tragedy. Ever thought about having only two choices? Why do we always choose the negative experience to talk about? Don't we eventually laugh when we tell others the story of over time about our divorce? Why not learn to accept divorce willingly, or learn how to smile, laugh, and joke about your divorce? After all, the other choice is very painful. I have with me to discuss this topic Dr. Nané Cheung, and she's a holistic health professional, amongst a million other things we've discovered about you. What's the name of that?
What's the name of it? HEALS, my new
Clinical
school.
nutritionist?
HEALS, clinical nutritionist, integrative healthcare.
Functional healthcare, integrating the body.
My original degree was a bachelor's in literature. So I come from a humanistic psychology, comparative literature background, and gone through pre-med, gone through chiropractic school.
Doctor of chiropractic, I see.
Doctor of chiropractic, master's in nutrition, diplomate. I have some years of education.
Lots of education, I see.
Lots of education, yeah.
All right, but before we get into all that good stuff that you have about your education, you're divorced. Now, could you tell us a little bit about what happened to you? Yes.
That's right. Oh, that's the funny part of my life. Well, the divorce, that's the interesting part. I actually, came to a place in my life, and I had young children, and I said, God has given us about 20 years together, good, bad, and ugly, and I think it's really time to call it a day. So let's just really try to do it amicably, and we have children to think about. And I really thought that we could, maintain a friendship, do family vacations together. So that was really my vision.
You're an optimist.
I'm an optimist. Let's do it in a holistic fashion. Let's be friends. We were friends before. We have children now. Let's kind of carry through, with a family dynamic, but individually, because we really weren't living well together. So, I don't advocate divorce. I mean, it's not a pretty picture to go through, and I certainly heard a lot of crazy stories, but I really thought I would make it through unscathed. And the system really stinks, I have to say. Yeah. I mean, it may have changed now, because I went through the process in the mid-2000s.
Hasn't changed.
It hasn't changed, yeah. I just thought like two people coming together could really, like on TV, it was LA Law or something like that. Mm-hmm. And actually, I'm not sure about other states, but I know, because I was living part-time in Florida for a while, a therapist there had said to me, this is what we do. We come to the table, you have, yourself, you have your divorce attorney and your therapist. Your husband has the same, and you work it out, until it's over. Whether it takes 10 hours, 12 hours, 2 days, you're at the table, which I think would be the best way to do it.
That's collaborative type. Right.
Completely collaborative.
Right.
And in New York State, I didn't find that to be the case at all.
No.
It's antagonistic, it's a battle, and I went through 3 divorce attorneys.
Isn't that a wacky idea when you think about it? It's an adversarial system. It's just the wackiest thing.
It's just crazy.
Yeah,
it's
I
crazy.
understand.
And then, at the end of the day, you realize that, people are in it really to make money. People are in it to keep you in an adversarial position. And, I try to keep what kept me going was really just keep my upper mind on, I'm coming through this. And, being a professional, being also, which didn't matter that I really had all my years of education.
What a waste, right?
It doesn't matter. I mean, at the end of the day, I was completely naive about the process.
Right.
But I had 2 children that
How old were they at the time?
They were probably about 4 years old.
Wow.
So young. And, I think my whole attitude kept them really out of the fray, for the most part. I mean, I didn't discuss anything with them. They were young, and
how long did it take?
It took about 5 years, almost 6 years.
Isn't that crazy?
I mean, from start to finish, really. And I thought within a year, because my first divorce attorney said, I said, how long? He said, a year. I was like, great. And at the end of that first year, I said, what happened?
Yeah.
Well, the judge and the this and the excuse and I said, oh, no.
Without telling me a dollar amount, you don't have to tell me, but they tried to drain you, don't they?
Oh, yeah, 6 figures.
Mm-hmm.
Yeah,
Well, that's what they were really
Insane.
hanging around for. That's how they make their money. The longer they can set that up for you, the more you're going to pay.
Right.
It's unfortunate. How many motions, how many, did you ever think about it? The wasted paperwork?
Completely wasted
paperwork. Is it nonsense?
And all the writing, and you know, the thing is that they, you know, you're looking for the information to make the other person wrong.
Right.
So that's what you're doing. You're just trying to make the other person wrong, you're trying to make yourself right, and then it becomes really adversarial. So
it fits into their hands. That's how it goes.
Yeah.
You use laughter in your practice. Let's go to your practice a little bit. That's enough about your divorce.
It's enough. It's over. Thank God. Thank God for small favors.
How long is it now?
How long is what now?
Been divorced.
Oh, let's see.
Before we get into
probably
your
what? I think officially 2010. I don't even know. I don't know the official date.
Good. You don't need
Actually,
to know.
yeah.
That's all right.
10, 8, 9, 7, I don't know, something.
All right. Let's go back to your practice here. How do you put laughter in your everyday practice, and how do you make it work?
Well, you know, it's interesting because when I sit and speak with people, I mean, what I try to do is, and you know, I had a large practice with people with AIDS in the city, and my master's was actually on HIV, weight loss, and diarrhea. So it's a very humbling experience when you're actually with people that, you know, I mean, people would come to me and say, you know, my medical doctor told me I had 3 months to live based on my blood tests, and so that was really the beginning point of my practice, where I said, you know what, it just seemed wrong to me to tell someone. I said, you know what, no one can play God, and so let's take that information, because I could die tomorrow, but who's going to forecast that? And just because it says that clinically doesn't really mean anything about that. So I would say to them, you know, put that information on the shelf, and let's really work and try to see what we can do about your health. And so, you know, within that, I really, you know, I have my own spiritual practice, and so I would talk to people about, you know, positive thinking and affirmation, meditation, and that really helped. I mean, to actually clear your mind of all the negativity, and clear your mind of what other people are telling you, and really get down to your own spirit base. And within that, the nutrition and putting in good nutrients, taking away things that were, you know, causing problems.
The whole picture.
The whole kit and caboodle. So, and I had great results with that. So I actually saw that put into action. So it was really a composite of body, mind, spirit. And then from that, you know, working with people with cancer. So it almost didn't matter what the diagnosis was, which is a little bit more of an Eastern concept. It doesn't matter the diagnosis. It matters really what's going on internally with people, because we see people miraculously heal. We see, you know, Bernie Siegel was one of the first doctors who was an oncologist who said, you know, love medicine and miracles. And, you know, there's Norman Cousins. I mean, there's so much research that we've seen now really coming through.
So there's a lot of things that can heal that previously we thought maybe an operation or something might change, whereas now you don't have to do that. So one of the things you do is you apply humor. The other is you apply holistic medicine. Holistic
medicine, what we call integrative. So it's really integrating a lot of different techniques, a lot of different modalities, you know, and it's always, you know, it really has to come from the person themselves. You know, what do you believe? So if you believe that you're going to die in 3 months, chances are you're really going to follow that path. If you believe you can be healed, chances are you can really move in that direction. So that, you know, I always think that's the foundation. The foundation is really your belief system.
Your belief system,
and,
right, yeah.
you know, my job as a practitioner is really to be your health coach. So to get, you know, to kind of elicit that, and anywhere that there's an imbalance, to really try to help you. So, you know, I'm almost like a detective, where I can, just from years of experience with people, I can actually say, you know, I think your thought, I can hear how you speak to me, and I can say, well, you know, I think this really needs to be revamped. And
you can see that sometimes these social pathologies and things like that, just by looking at somebody sometimes and how they behave, right?
Yeah, looking, how people, you know, body language, how people speak. And inevitably people would come back to me and laugh with me. I mean, you know, it's not that I'm laughing.
You take a lot of chances, young lady. How do you, don't you think that's a risk to make people laugh when they're ill?
No, it's the biggest joy in the world. And people, you know, you can't cry and laugh at the same time. I mean, you can cry, but it's almost laughter. It's bringing joy into someone.
There's
It's
healing
not
in
me,
it.
it's not that I'm making you feel joyful, it's me unraveling and revealing so that you actually get to the point that you experience it yourself. So it's not like I'm laughing at someone. I mean, it's not a funny situation to be diagnosed with HIV or cancer or Crohn's or anything like that, or parents coming to me with children with autism. I mean, it's not like it's something to be laughed at, certainly. And I think if I had that position, people would not feel joyful
Yeah,
working
I never
with me.
assumed that would be the case, but so you
Yeah.
actually can see somebody transition from a place where they may be feeling or looking like they were ill to health.
Exactly. Yeah, because I really, it's my belief system, and when people come to me, they're coming because they resonate with that belief.
Yeah, yeah.
So the idea is that when I see people, I don't see them as obese, or I don't see them as having AIDS, or I don't see them as having cancer. So I don't diagnose someone according to what their clinical diagnosis is.
I'm not sick right now, but if I do, I'm calling you, okay?
Okay.
Now, you say that laughter is the best medicine. So in the same vein, we're talking about making that a focus, aren't you?
Well,
it's
I've
certainly one of the
developed
modalities, it's
Yeah,
one of
I think it really is a modality because it, it's a way really of allowing the healing to occur in your body. And we're so bombarded with drugs right now. I mean, the whole healthcare system, I think, is really off because we're focusing on disease, we're focusing on drugs, we're talking about a healthcare system, but the healthcare system has no discussion about healthcare. Like, where does health really begin? It begins with your thought process, what you're eating, how you're taking care of yourself, how you're moving from point A to point B, but it's not a linear fashion. It really is an organic place. And so, part of it is that what we're discovering, it's almost like quantum physics. I mean, what we're discovering is that, just by virtue of what you look at, what you hear, what you think, what you eat, that's where
It all makes a
the
difference.
healing, it's all composite. It's
Right.
not that any one thing stands alone. So it's not that one drug will cure you or one thought will cure you. I mean, it really is. We understand it's the family dynamic.
Years ago, everybody would have said you were a little wacky young lady. But not only do I buy it, I know it now.
Yeah, I attended a functional medicine symposium actually this year in January in Manhattan. And it was interesting because there is a mind-body center, and there was a room of about 300 people. Now this doctor, psychiatrist, what he does, and he was talking about working with trauma victims. So, we may think of trauma in terms of accidents, or we think about, war or vets coming home. What he does is actually, and I was shocked by this, but it resonated completely because he had 200 or 300 people stand up in the room. And he said, I'm going to show you what I do when I go to Syrian war camps and when I go to Palestinian camps. And these are people that have been in war for years and years and seen really brutal, horrible, atrocities, families and limbs, and you can just imagine the horror stories. So he had everyone stand up and he said, all right, you may not feel it, watch me. This is what I do to get people to heal. And he started, he's about 6 foot something, big guy, and he started going, all right, ha 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 ha, until people actually, started coughing like that, and everyone was hysterical. It was just completely infectious. He said, if you can't get it in yourself, watch me, follow me, imitate me, and start doing it. And within 5 minutes, the whole room, imagine, almost 300 people standing there, doctors, acupuncturists, chiropractors,
from all walks of life.
All medical professionals laughing, hysterically laughing. And he said, this is so simple and it's so powerful. And I thought, it's exactly what I do. What I feel is that how it came to me in practice was patients saying to me, oh my God, I don't laugh like this. I don't laugh like this. Do you laugh like this with everybody? And I was like, yeah, I do.
Yeah.
So it's almost become a trained response with me, that I've actually been able to bring to practice. And getting back to divorce or any trauma that you go through in your life, it's almost a learned behavior, but you can access that easily once you continue doing it. And then your life really becomes, it's almost like a gift that you can pass along to other people.
Yeah. Some people equate the suffering and the sadness rather than the loving and the laughter. Wasted.
It's, I don't think that I think there's a place for grief. There's a place for suffering. So it's not about overlooking the feeling. You know, I mean, there's sadness when somebody dies. There's sadness when you're hit with a diagnosis. I mean, there's a place that you need to.
Or hit by a truck.
When you get hit by a truck, you know, there's a process that goes on. But ultimately, I think that what you look at is, you know, the joy of life, the beauty of life, the miracle of life. And I just read an article yesterday about this woman. I think it was 2 years ago that her 3 children were killed in a fire, you know, over the Christmas holidays. I mean, and her parents. And I thought, I mean, in your mind, you can't imagine that you can ever recover from something like that. I mean, it just seems so, you know, such an atrocity. But here she is 2 years later telling the story of how she recovered after really wanting to commit suicide, thinking she had nothing to live for. And, you know, somewhere in her life finding joy again and joy of living, because, it, you know, you know, it really comes from my thinking that life is so precious. So why waste a moment of it?
I worked briefly on a suicide hotline, and this was a long time ago. And I found that was the first time in my life I ever felt somebody else's depression, and it caused me to be upset about it.
Right.
I'm not the type to be depressed about anything.
Right.
But I felt that pain. And
Yeah.
I never forgot that, because I haven't felt that pain since. You know, that was a whopper.
Right. Right.
When you're clouded with it. So when people say they're very ill and they feel that feeling of being extremely ill for whatever reason
Right. Yeah.
that they got there, they have trouble getting over that. Your suggestion is viable. I couldn't make the guy on the phone I was talking to laugh.
Right.
I wasn't trying to make him laugh, but I couldn't
Yeah.
change his mode. I couldn't change his mood.
Right, exactly. Yeah, I mean, it's almost knowing somewhere that you, and it's not about trying to make someone laugh. I mean, it's not like.
No, I wasn't really trying to.
Yeah, and with situations like that, again, someone with cancer, AIDS, or someone, you know, wanting to
Like
commit
that,
suicide.
yeah, like
I mean,
that,
really,
yeah.
it's like someone has hit bottom. So it's not about telling a joke. It's really having a human conversation, and getting somewhat to the core of that pain, and then within that, shedding some light on it. And usually when you know, me as a practitioner, when I try to shine some light on that and just give the person another perspective of that, I mean, that's where that, you know,
The transition,
the
that
light
little
can
tip.
turn on a little bit. Even if it can turn on a little bit, it's still, a flicker of hope. You know, it's a flicker of light. And then, you know, basically, you would take it from there.
Let's go back towards something else in the same area. I don't want to go all the way back to where we were before. We'll eventually get back to your divorce. Healthy Girl's Guide to Divorce. Do you want to? What's all that
A Girl's
about?
Guide to Healthy Divorce.
Oh,
A Girl's
okay.
Guide to Healthy Divorce.
Okay.
Well, you know, it's interesting because in retrospect, I think, and again, personally speaking, I had no clue about divorce. I mean, I did not enter marriage envisioning divorce, but when I was in the, you know, I mean, the bottom line for me was I thought if I stay in this marriage, something, you know, I would get ill. And I knew, it's like, I know better. I know better what emotions and negative emotions can do to a person. And so, you know, for me it was, you know, making a choice of the lesser of two evils. So that was just a cute way, a girl's guide to a healthy divorce. I mean, I think you can have a healthy divorce.
Yeah, go ahead.
You know, I really do. And even today, I mean, I wouldn't think twice, you know, about counseling people about staying together or getting a divorce. I mean, I'm not attached. You know, the goal is that people stay healthy and happy and they work through the issues. If you can't, though, you know, my thing would be you really want to focus on if there's children, and, you know, try to maintain treating each other as if you're still
If you're staying
friends.
in a good mood or upbeat personality with your children around, that is in a
Right.
way showing them how you're handling
Yeah,
the difficulty that
yeah,
you're having.
exactly, yeah. And I have to say, I mean, I don't think my kids really skipped a beat. You know, they didn't see me, you know, it's not that I never cried, it's not that I
Unwind,
never
yeah.
grieved, but they never really saw me like have a meltdown around it. I mean, I really
Right.
kept their life going smoothly, activities and smoothly, and,
Yeah.
you know, never talked badly about their dad or, you know, I mean, privately, that was a different matter. But,
Yeah.
you know, for the family dynamic, I think that's really crucial. And people have to understand that. You know, that's really part of the process.
Yeah, we have trouble figuring out how to make people happy, and as a mediator, because I do divorce mediation, when they're going through that process, if I can get them past the first session, I find that my success rate is really good.
Past the first session of wanting to kill each other.
Yeah, that first session
Right.
is usually a difficult one.
Yeah.
So I brought a penalty flag with me, red flag, and then as soon as something happens, I warn them ahead of time if there's something outrageous happening in order to keep them quiet, that I would let them know. So I throw a penalty flag, it freezes them.
Right.
So sometimes a shock or a change works to get somebody's attention and keep them focused so you can facilitate change.
Right, yeah.
In your situation, your red flag, as mine was as a mediator, is laughter. Right? It's work, right?
I mean, there's techniques, even getting someone to quiet down in meditation. I mean, teaching people how to meditate would be something, just to keep calm, keep into your own inner spirit rather than being on the attack mode. It's almost like you can't necessarily do everything simultaneously. The thought is maintaining one thought process. So I think it's working along the same lines.
You don't have to think about it, though. You don't have to think about what you're doing. You're relaxed about it, and I can read that in your personality.
Yeah.
So that works in a lot of different ways.
Yeah.
Passing that along to somebody else. Have you thought about, did you have a school or something, or a training?
Well, that's my new project now.
Let's hear about that.
My whole approach, I mean, my logo has been for years, make your body a better place to live. So within that, it's
good idea.
It's a good idea, right? From the inside out. So, and my approach with patients has always been, I can't give you health. I cannot sell you health. I always feel that people come to me when they're ready to hear what I have to say. It's not a traditional medical approach. I mean, I blend a little bit of East and West and spirituality and meditation. So, I use a lot of different tools, and I see which one works
It's a sellable,
for you,
it's a sellable method you have going on. It's a sellable, maybe you should think about how to move that.
The educational part of it is really working with teaching people, meditation. There are certain affirmations you can do. There's certainly ways that you can eat better because, all the junk food, all the medicine and the drugs, and I mean, sugar makes people crazy and caffeine makes people crazy. So there's just on an emotional basis, I mean, there's so many, chemicals in our foods and just clearing that out of a
That's
person's.
scary, though, that thought, because I've tried that many times.
It's scary? What's
I can't.
Leaving McDonald's?
Too much research. No, well, they don't do that. I don't do that. But I mean, once in a big while, I'll have something, like a little odd. And then our mutual friend, Lisa's tried to beat me up. Our mutual friend has tried to beat us up, beat me up over it.
Right, yeah.
How much can you do?
What you do like 80% of the time. So if you carry enough of a routine, I mean, if you actually make those changes, I mean, your whole biochemistry shifts. I mean, that's really where, science is going these days, and medicine really needs to follow with that. Because we are actually, with the advent of increased diabetes and obesity and metabolic syndrome and cardiovascular disease, we're basically destroying our bodies from the inside out, really with junk food. I mean, literally.
I mean, organic. How do you stay in that organic modality? How do you avoid other things that you buy at the supermarket? You don't know whether it's organic or not. You don't. How do you do all that? I mean, that's a lot of work.
It's not so much work. I mean, it's just once it becomes your lifestyle, once it becomes your kind of overall thinking, then it's not something that you have to work at. I mean, it becomes a life choice.
We went to the same school. I studied nutrition at Hunter College also. We had, that. Right. But my remembrance of what that was about is not where we are now.
Well,
we've learned a lot since then.
We have learned a lot since then, except if you go into a hospital and you see the food preparation, I mean, it's almost sinful. That's not nutrition. That's really eating dead food, trying to keep people alive. That's not about giving someone healthy, live enzyme foods. Yeah, I mean, what's happening in hospitals? I mean, they're saving people. I mean, hopefully people don't have to wind up in hospitals. So they're doing the drug intervention, but basically the food is not food that's enlivening you in any way. You're not getting really pure nutrient. You're getting dead, overcooked.
Jeez.
I mean, I've had patients go to hospitals and they say, "Oh, I'm a vegetarian." It's like, okay, here's chicken soup, here's chicken broth, and here's some coffee. That's not food. That's not real live food. I mean, we've gotten away from good food, live food. I mean, for the amount of money that people spend in hospitals and staying in hospitals, they should be having gourmet organic meals. Why not?
Do you eat vegetarian? That's supposedly.
Yeah. I mean, I've been a vegetarian. For
I tried
3 or 4
that
years.
too.
It's not for everybody. I mean, I look at people's blood types. I look at your lifestyle. Seasonal. Seasons change. I mean, it's easier to be vegetarian in the summer, in the spring. It's harder in the winter. I don't think it's really for everybody. Mm-hmm. With patients, I like everyone to try to be a vegetarian, just to kind of clear out the gunk in your body.
Do you look at the blood also? You said that?
I look at blood tests. Yeah. I mean, there's more in-depth analysis. I mean, there's cholesterol panels, there's inflammatory markers, there's insulin, sugar levels. There's so much more that can be looked at. But again, and I learned this from working with people with AIDS. I mean, the blood does not tell the whole story. So you really need to look at the blood, the chemistry, some stool analysis. I mean, there's so many clinical tests to look at, but you also need to look at a person's lifestyle. You need to look at family history, and as well. You need to look at someone's own philosophy about living. Some people really kind of need to lighten up their thinking about life. I mean, they're feeling depressed, but a lot of the depression sometimes is linked to how you eat and how you think and the relationships that you're in also. I mean, sometimes, there have been books written about this. I mean, sometimes you feel like you're in a dead relationship or you're in a really toxic relationship, and that really affects your mood, your swings, the way you eat, the way you drink, overeating, overdrinking.
There must be something wrong with me. I don't really find all those mood changes in the relationships that I've had in my life. I just either it works or it doesn't work.
Right. Well, that's good.
By the way, is that good?
I mean, it's good.
From a doctor, am I really?
Because the idea is that we have a certain feeling, like a gut feeling. I mean, our gut has, our stomach and our gut has all the nerve endings. It has the most amount of white blood cells, so it's our immune function. But we tend to overlook our gut. I mean, it's been called the second brain. It's actually, it seems to be even a stronger way that it tells us what's going on, what's right or wrong, and we overlook it. And we put so much junk in our gut that we don't even have a sense of what our gut feels like. You have so many people that are just kind of overloaded with junk. They don't know how they feel. They don't know what to react to, what not to react to. So they overreact, they underreact. So we're so out of touch sometimes with our own emotion.
Just tell us in the remaining 2 minutes or so we have left, how does a person apply this? To apply the health and the health of mind and, all in one shot. I've tried the nutrition thing a few times, and I find that I have a sensible way of eating primarily, but, occasionally I go off. I'm not worried about it. Right. Should I be worried about everything that I eat? I'd rather not.
Well, that's the other side of it, and it's funny because I've met people that are vegetarian, and they're or they could be so angry. And it's like, well, what's the point if you're angry about people that eat meat or angry about this?
You're right, I've seen that. I know exactly what you're talking about.
So it's the same thing. It doesn't mean that one way is a purer way to live than the other. And it's not one shoe size fits everybody. So I'm not that type of practitioner. I don't think, that you need to do anything in particular. So that's why, when we're working through, again, it's philosophically, like, what's your belief system? What's your culture? Where do you come from? I think that what makes sense and what we know is, I mean, the Mediterranean diet, it's really eating healthy foods, simple foods, it's protein foods, carbohydrate being fruits and vegetables, and not only artificial.
While we're on the nutrition thing, what about the gluten thing?
Well, there's a lot of gluten sensitivity. I mean, part of what I think is adding to that is, we're eating so much over-processed food. We're eating, the GMOs, the genetically modified foods. So we don't even know all the chemicals. I mean, in this country, we get 200 to 300 more chemicals than they do in Europe and in Canada.
Way too much.
So it's really a composite of so many different things.
Tell us real quick about because we have less than a minute left, about your new grand opening.
So 2014, February, it's HEALS, which is Health Through Education, Actualization, Love, and Self-Realization. And it will be it's school of one, meaning that wherever you are, we want to work with you. So if someone needs, stress management, meditation, learning about the inner workings of your body, nutritionally. There'll be classes. We're calling it a HEALS Conference Center.
And the website that they can go to get to
is HEALS, HEALS schoolofone.com.
Schoolofone.com. Thank you very much, Dr. Cheung. I appreciate that.
Thank you so much.
Societal and political trends are rapidly breaking down the family that once was the cornerstone of our great American culture. At FIT, we know you cannot get this information on your own, so we'll bring it to your TV every week. We always invite opposing views if there are any. There won't be any here, I don't believe. My name is Chris DiMaggio. Thank you for watching FIT TV, and we'll see you again next week.